Welcome to this special presentation of Investing in Psychedelics, brought to you by the Canadian Securities Exchange in partnership with CFN Media.
Welcome, everybody. I'm Anil Mall with the Canadian Securities Exchange. Thank you for joining us for our virtual conference that focuses on investing in psychedelics. Today, I am talking to Mr. Michael Frank. Michael is the CEO of Revive Therapeutics that's listed on the Canadian Securities Exchange. And Michael, thank you very much for joining us. How are you today?
Great. Thank you for having me.
Great. Michael, why don't we start off by you telling our audience a little bit about Revive Therapeutics and what the focus of the company is at this time?
Appreciate the question. Revive predominantly is a pharma IP company. We have a rich platform of patents and IP in a variety of sectors. Namely, the company has done a lot of work in the cannabis sector, developing some strong licensing with the University of South Carolina, where we have basically the use of CBD to treat autoimmune hepatitis and ischemia. We were granted orphan drug designation for those protocols, and we started to work a lot on that over the last several years. And right now, we're leading off in terms of a lot of our initiatives right now with a drug we brought to market in 2016, where we repurposed psilocybin for the use of gout. We got a lot of data on psilocybin basically to treat gout inflammation orders, and basically that's where we took the company to a phase 2 trial. And also we did got approved to do a phase 2 trial for cystinuria, which was kidney stones. So we have a rich IP platform, and working with clinical path, working with the FDA, and we saw an opportunity back in sort of February to work with Derek and his team in terms of Psilocin Pharma. Psilocin has some strong formulations around psilocybin, and we just saw a very good fit in terms of what we're doing with our IP in pharma, and just complemented it all. Predominantly, we felt that a lot of the work in psilocybin would have the most merit right now working down a clinical path and working with groups such as the University of Wisconsin, where we have basically brought in the licensing, which we've put together on the CBD side. We're working with the university right now to look at various delivery systems where psilocybin will have potentially faster onset and longer lasting experiences using a lot of the IP which we procured from the University of Wisconsin. So predominantly, Revive is an IP portfolio company. It's worked with universities. It's got basically a company, right now psilocybin as one of its key stories, where we submitted our IND, looking to move towards a phase 3 clinical trial with psilocybin to treat lung inflammation around infectious diseases. And also complementing that, obviously, as I mentioned, we have a rich portfolio in cannabis. And what we're doing right now is also very, very focused on psilocybin with Derek and his group in terms of harnessing that down the path clinically, working with the university, and eventually running it further down clinically, and eventually getting it to build product.
What is your market strategy? I mean, being a cannabis company that's now focused on the psychedelic, or not now focused, but is also focusing on the psychedelic space. What made you guys make that shift?
Yeah, well, the company, as I mentioned, it was not a cannabis company. It's a pharma IP company. The company started off repurposing drugs back in 2012 around depression. Then it repurposed a drug called psilocybin. As I mentioned, psilocybin was used very actively in Japan and South Korea to treat rheumatoid arthritis. We repurposed it for gout, and we basically took it to a phase 2 trial, which was substantial. So we have a lot of IP in our war chest. Right now, as I mentioned, we're taking that psilocybin repurposed against infectious diseases, and we're submitting an IND for phase 3. But because we're pharma IP, as I mentioned, we do have a rich IP portfolio around cannabis as well. We felt the psychedelic was going to be a very strong area, and we had an opportunity to work with Derek and his team, and we acquired the company back in March, really to focus on bringing psilocybin-based products to market and doing a lot of clinical work there. And since then, we brought in a strong partner with the University of Wisconsin and some of their IP, which we've licensed, and are going to be very, very key in sort of bringing our initiatives down the path. So we're basically a pharma IP platform that has focused on a few key areas, namely infectious disease, rare disorders, psilocybin, and yes, we do have a strong platform in pharma around cannabis.
Got it. Thank you very much for clarifying that.
No problem.
You mentioned Derek and Psilocin Pharma. We'll also be talking to Derek a little bit to get more details on Psilocin Pharma and what their focus is. You've mentioned your team. Obviously, you mentioned Derek and Psilocin Pharma. You mentioned the University of Wisconsin. Can you talk to us a little bit more about that and elaborate on how you've put some of these key players together?
Right.
And who they are?
Sure. I mean, right now, in terms of as a company of its whole, we have some key guys on our board that have worked in the pharma space and also in cannabis. But as far as our path forward, we're working with some key guys out of the University of Wisconsin that are very, very well versed in the study of plants and working with plant-based formulations. And they're part of our team now in terms of our partnership with the University of Wisconsin. So they have a very strong background working with different type of plants and fungi. So they're going to be one of them is Christian Kruger. He comes to the University of Wisconsin, and they're going to be key parts of our components go forward with psilocybin, working with Derek and myself and the rest of our team. On the other areas of the business where we're well advanced on the clinical side, as I mentioned to you, we're embarking potentially on a phase 3 study. We're just finalizing or submitting our IND, which is very, very substantial. We're working with large CROs in the U.S. and some key doctors that are helping us, formalize the paperwork and the plan. So a lot of our team is working with third parties, outsourced to get the right initiatives to market. As I mentioned before, I think specifically on the psilocybin side, which is a big focus of this segment, the key there is that we believe that the clinical validation is going to be very key, and the universities and their pedigree add the most to the table. Therefore, we brought in the University of Wisconsin because of the IP we have built with them and work with them in terms of a licensing arrangement. We believe there'll be a lot of benefits for psilocybin on that end, and that gives us the team at the university to draw upon.
Interesting. So thank you very much for that, insight into the players of your company, the guys you've brought together to move the project forward. Do you want to talk about any of your recent milestones or any upcoming milestones that you want to mention?
Sure. In terms of a company as its whole, I mean, I took over the company in December. We went, tell the market a lot of our story in terms of what we're doing in the cannabis side with CBD, which I do still believe is very strong footing. Especially I see cannabis coming back and the next wave being pharma. We have some very good IP there, as I mentioned, with CBD and some of the work we did with the University of Carolina to address a lot of the rare disorders in the marketplace, such as autoimmune hepatitis and people like that. There are couple companies around doing work with cancer and stuff. So that whole sector is still very prevalent. And, we hope to move that down the clinical path. The more immediate initiatives, as I mentioned, was right now moving to phase 3 with our basilamine drug for infectious diseases, finalizing that paperwork and the IND. We hope to have final information there over the next 45 to 60 days in terms of moving forward on the study. And then on the psilocybin, which is very, very key to our initiatives right now, we're embarking on a number of studies right now at the University of Wisconsin and moving down the clinical path there as well in the lab in terms of looking at different delivery formats and how the delivery technology, which we have licensed from them, will enhance the psilocybin experience. They have basically some very strong IP on tannin and chitosan-based formulations, which are predominantly shrimp and plant-based platform. And when you mix it with psilocybin, we're going to look at the enhanced onset and basically delivery mechanisms around that. So we're focused on moving that down the next 60 days more aggressively and, to build our team around that and to basically, educate the market and obviously to move towards more of, product and other initiatives around formulations and getting stuff to market.
Got it. Michael, I appreciate your time. This here was a little insight into Revive Therapeutics. Michael Frank, the CEO, as well as some of the team members they put together. I encourage anybody listening and watching this clip here to sign up for our Investing in Psychedelics virtual event that takes place on June the 17th. You'll have a chance to watch Michael on the panels there, as well as Derek, and be able to answer any questions that you might have. Why don't we end off this little clip with you telling our viewers on where they might be able to learn a bit more about Revive, and where can they find out more details about what you guys do?
Right. Thanks for the question. Right now, I think there's quite a bit of information on the web in terms of a number of articles written by third parties on our company, on our IP, on our platform, and what we're doing in different markets. And as far as obviously psilocin and psilocybin, Derek can address that shortly. And we also have a lot of information on our website and through some of the media that's basically covered the company, and you'll hear a lot more about it over the coming weeks.
Perfect, Michael. I look forward to learning a lot from yourself and your team members on June the 17th. Again, if you haven't signed up, feel free and do so. It's a free virtual conference that will not only educate you, but also introduce you to some of the key players within the psychedelic space.
Thank you so much for having me.
Thank you, Michael.